So, we're really finding that the government funding today is really building an infrastructure for health information to actually flow, but the majority of the design that the government's putting in place is really provider-to-provider communications and really trying to fix the back-end plumbing of healthcare. We're not seeing a lot of indication that there's going to be a tremendous amount of patient engagement that actually encourages a patient to manage their own health as much as engage more in the healthcare process itself. So while it builds a really important foundation, I think there's a chicken and an egg issue here where we as consumers are very accustomed to our cell phones and our cable TV or however we actually access information, but we don't utilize those tools for healthcare. But without actually having digital information in our doctor's hands, we actually can't utilize any of those tools to really engage in our health. So we really do need to build this foundation that the government's been investing in, but at the same time, we need to find ways to actually engage patients in ways that are meaningful to them, that we use in our everyday lives, that just become part of what actually helps us manage our health and not just rely on our doctors or whomever we're obtaining information from. So engagement from my perspective is having a patient or consumer actually caring about setting goals or managing anything about their health. So that kind of engagement is actually awareness and really focusing on knowing that you have a tool that you might need to or want to use, or knowing that you're actually kind of monitoring what your weight is or how far you've run and how that's impacting your overall fitness. So it's a combination of tools and just really self-awareness that makes you want to do something. And I think engagement is a really challenging word in healthcare today because we don't really know how to engage patients in ways that several other industries have engaged consumers. And I think we're still experimenting with what that looks like. And between privacy and security concerns and other issues, we're taking baby steps and need to really start taking leaps of faith, if you will.